Good morning. My name's Dr. Tom Fry. I've been an orthopedic surgeon now for almost 40 years and have been doing primarily the upper extremity. So today we're going to talk a little bit about shoulders. Shoulder pain is an extremely common problem. It can result from trauma, and it can also be degenerative. So those of us that in our 50s and 60s tend to be getting problems with the shoulder. To break down the shoulder, you have four major muscles in the rotator cuff. You have the joint between the collarbone and the shoulder, and then you have several tissues inside the shoulder joint which provide stability. Unfortunately, all of these can wear out, all of them can tear, and trauma can damage all of these different structures. For most people with shoulder pain, we have a rotator cuff that may be torn. We have a biceps tendon which can tear, a labrum, which is a support tissue in the shoulder itself, which can tear. We also have bone spurs that form, especially as we get older. The bone spurs can then impinge or cause damage to the tendons of the rotator cuff. Frozen shoulder can come from almost any cause, and anything that creates pain can limit your motion, and the shoulder can lose that motion, hopefully not permanently. For the rotator cuff tears, the bigger tears usually require surgery. Smaller tears can be treated, at least initially, with therapy, sometimes steroid injections, to try and get function back without the need for surgery. The bone spurs can generally be taken care of with an arthroscopic surgery where we shave the spurs off, and that can decrease the pain and the rubbing on the tendons. For a frozen shoulder, usually we try to fix that with therapy by increasing the motion, but sometimes it does require either surgery or what's called a manipulation under anesthesia, where we take the shoulder when you're asleep and we move it and gain your motion back, and then you have therapy to keep that going. Rotator cuff tears are one of the more common problems that we see, and along with biceps tendon and labrum tears, generally do require some surgery if therapy and injections don't work. The therapy is generally 6 weeks, and if you're not getting progress, then we move on to something else. The surgery nowadays is mostly done through a scope with somewhere between 3 and 4 small incisions, and that usually allows us to repair things without any difficulty. Thank you. Again, my name's Dr. Thomas Fry, and I've been doing orthopedic surgery for almost 40 years. We'd be happy to see you at our office at 8550 West 38th Avenue in Wheat Ridge, Colorado. We can certainly have you call for an appointment at 303-421-1440. We try and keep our appointment waiting list to 2 weeks or less so that we can get you in on a quick basis when you're hurting. If you have any trouble, we'd be happy to see you.